The idea of separating the sick from the healthy is not a new one. It is as old as human society itself. Ancient texts, from the Old Testament to the writings of Hippocrates, speak of isolating those with illnesses like leprosy. This was, a basic human instinct for survival. People understood that something unseen could pass from one person to another, causing sickness and death. They did not know about germs or viruses, but they saw the patterns of disease. They observed how illness could spread through a family or a village. This simple observation, this fundamental understanding of contagion, laid the groundwork for one of public health's most enduring tools. It was a practice born not from science, but from fear, observation, and a desperate need to protect the community. The word quarantine itself tells a story of its origins. It comes from the Italian phrase 40 giorni, which means 40 days. This term was born in the 14th century, a time of immense suffering and fear. The Black Death, a devastating plague, was sweeping across Europe, wiping out a significant portion of the population. In the bustling port city of Ragusa, now known as Dubrovnik, officials made a groundbreaking decision in 1377. They decided that all ships arriving from plague-stricken areas had to anchor at a distance for a period of time before their crew and passengers could come ashore. This waiting period was initially 30 days but was later extended to 40. This period of 40 days was not chosen at random. It held deep cultural and religious significance. In the Christian tradition, 40 days is a period of purification and trial. It recalls the 40 days of the Great Flood, Moses' 40 days on Mount Sinai, and Jesus' 40 days of fasting in the desert. This number represented a time of waiting, of testing, and of hope for renewal. By imposing a 40-day isolation, the authorities of Ragusa were blending practical public health with deeply ingrained cultural beliefs. This made the difficult measure more understandable and acceptable to the population, who saw it as a necessary penance to cleanse the city of the dreaded pestilence. The Ragusan experiment was a turning point. It was the first time a government had organized a system of isolation on such a large scale. This was not just about separating a few sick individuals. It was about controlling the movement of entire populations of travelers and goods. Other Italian port cities like Venice and Genoa quickly adopted and refined the practice. They built special isolation stations called lazarettos on nearby islands. Here, travelers, crew and cargo would undergo their period of quarantine. These early efforts were crude and often harsh, but they represented the very first coordinated, state-sponsored public health response to an epidemic in history. As centuries passed, the practice of quarantine spread from the Mediterranean ports to the rest of the world. It became a standard defense against the invisible enemies that traveled along trade routes. Whenever a ship arrived in a harbor, it was met with suspicion. Port officials would ask the captain, "Where do you come from? And is there any sickness aboard?" If the ship had sailed from a place known to have disease, it was ordered to fly a yellow flag, a universal symbol of quarantine. This simple piece of cloth was a powerful warning, telling everyone to keep their distance. The ship and its occupants were now in a state of limbo, caught between the open sea and the safety of the shore, waiting for the 40 days to pass. In the 18th and 19th centuries, the United States faced its own devastating epidemics. Yellow fever, a terrifying disease carried by mosquitoes, repeatedly struck coastal cities like Philadelphia, New Orleans, and New York. In 1793, a massive outbreak in Philadelphia, then the nation's capital, caused widespread panic. A third of the city's population fled in terror. Those who remained saw the value of isolation. Officials established quarantine stations, such as the Lazaretto on an island in the Delaware River, to inspect incoming ships and isolate the sick. These measures were often controversial and difficult to enforce, but they were the only defense people had against a disease they did not fully understand. The battle against disease also highlighted social divisions. Quarantine measures were not always applied equally. Often, the poor and immigrants were singled out and subjected to the harshest conditions. In the late 19th century, when cholera scares swept through New York, Passengers in first and second class were often inspected quickly and allowed to disembark. However, those traveling in the crowded, unsanitary conditions of steerage were forced into lengthy and uncomfortable quarantines on islands in the harbour. This created resentment and fueled debates about justice and human rights, questions that continue to surround quarantine practices even today. It showed that public health decisions could reflect the prejudices of a society. Despite these challenges, each outbreak taught valuable lessons. The experiences with yellow fever and cholera pushed cities and states to create more organized public health boards. These new government bodies were given the authority to enforce quarantine, clean up unsanitary conditions, and collect data about diseases. This was a slow and often difficult process. People debated the limits of government power versus individual liberty, but the relentless threat of epidemics gradually shifted public opinion. The understanding grew that public health was a collective responsibility and that sometimes individual freedoms had to be temporarily limited for the good of the entire community. The late 19th and early 20th centuries brought a revolution in understanding disease. The groundbreaking work of scientists like Louis Pasteur and Robert Koch finally revealed the true culprits behind the great plagues, microscopic germs, bacteria, and viruses. This was the dawn of germ theory. The invisible enemies that had terrified humanity for millennia now had names and faces, visible under the lens of a microscope. This new scientific knowledge would forever change the practice of quarantine. It was no longer a blunt instrument based on observation and fear, but a targeted strategy guided by scientific principles. Public health officials could now understand exactly what they were fighting. With the discovery of specific pathogens, quarantine could become more precise. Scientists could study how each disease spread, how long it took for symptoms to appear, and how long a person remained infectious. This meant that the arbitrary 40 days could be replaced with scientifically determined periods of isolation. For a disease like smallpox, the quarantine period could be calculated based on its known incubation time. This new approach was more effective and less disruptive. It allowed public health authorities to focus their efforts on those who were truly at risk, rather than imposing broad, sweeping restrictions on entire populations of travelers. It was a move from superstition to science. This era also saw the development of new tools to fight epidemics, which worked alongside quarantine. The most powerful of these was vaccination. Vaccines could provide immunity, preventing people from getting sick in the first place. This reduced the need for large-scale quarantines. Medical screening also became more sophisticated. Doctors could use new diagnostic tests to identify infected individuals quickly, even before they showed symptoms. This allowed for early isolation, breaking the chain of transmission much more effectively. Quarantine was no longer the only line of defense. It was now part of a larger, more complex arsenal of public health measures. The story of Typhoid Mary is a perfect example of how these new ideas came together. Mary Mallon was an Irish cook in New York in the early 1900s. She was a healthy carrier of typhoid fever, meaning she was infected and could spread the disease, but showed no symptoms herself. Health officials traced several typhoid outbreaks back to her. Because she refused to believe she was a carrier and would not stop working as a cook, she was forcibly quarantined for many years. Her case was highly controversial, raising important ethical questions about individual rights versus public safety. It demonstrated the new power of public health to track and control disease, but also the profound challenges of using that power. In the 21st century, the world is more connected than ever before. A person can travel from one side of the globe to the other in less than a day. This incredible mobility has brought many benefits, but it has also created new challenges for public health. A new disease emerging in one corner of the world can spread globally with breathtaking speed. This reality was made clear during outbreaks like SARS in 2003, Ebola in 2014, and the COVID-19 pandemic that began in late 2019. In this modern context, the ancient practice of quarantine has been re-examined and adapted. It remains a critical tool for slowing the spread of a new pathogen, buying precious time for scientists to develop treatments and vaccines. The COVID-19 pandemic brought the concept of quarantine into the daily lives of billions of people. For the first time in a century, entire cities and countries implemented large-scale lockdowns, a modern term for a very old idea. People were asked to stay home, schools and businesses were closed, and travel was severely restricted. We learned new terms like social distancing and self-isolation. These measures, while disruptive and difficult, were a direct echo of the efforts made in Ragusa and Venice centuries ago. They were an attempt to break the chains of transmission and protect healthcare systems from being overwhelmed by a flood of sick patients. The pandemic also reminded us of the timeless challenges associated with quarantine. We once again faced the difficult balance between public safety and individual freedom. We saw how isolation could take a heavy toll on mental health and the economy. Debates raged about the fairness and effectiveness of different measures. The pandemic also exposed inequalities, as the ability to work from home and safely isolate was a privilege not available to everyone. Frontline workers, often in lower-paying jobs, faced the greatest risks. These are the same social and ethical questions that societies have wrestled with since the very first quarantine orders were issued. The long history of quarantine offers us profound lessons for today and for the future. It teaches us that we are all connected and that the health of one person can affect the health of an entire community. It shows that in times of crisis, coordinated action and scientific guidance are our best defense. Understanding this journey, from the plague ships of the 14th century to the global response to modern pandemics, is essential. It is a story of fear, discovery, and resilience. It is a reminder that while the diseases may change, the fundamental human need to care for one another and to protect the community remains a constant guiding principle.